All right, if you're a healthcare operational leader, you know this feeling. You've got these critical initiatives, things that could dramatically improve patient flow or boost revenue or even just reduce staff burnout, but they just aren't moving. So today, we're going to walk through a really simple but powerful framework to get those exact projects unstuck and finally across the finish line.
So, does this look familiar? I mean, you've probably got a dozen high-priority projects on your plate right now, but they all feel like they're moving in slow motion, right? Kind of stuck in this big organizational traffic jam. It's a daily reality for so many directors of operations, and let's be honest, it's just exhausting.
And these symptoms? Oh yeah, they're probably hitting a little too close to home. You've got tasks that just quietly drift off. Delays that nobody, and I mean nobody, intended. Key decisions are just sitting there waiting for someone who might not even know they're the one holding things up. And all of this leads directly to leaders like you carrying way more than your share and your staff hitting that wall of initiative overload.
And look, this isn't just a hunch or a feeling. The data backs this up in a big way. When you look at really large-scale projects, like a big new IT or ERP system rollout in a hospital, the industry-wide failure rate is a staggering 75%. And here's the key thing. This isn't about you or your team failing. It's a systemic problem that costs a fortune in wasted time and resources.
Okay, so if it's not the strategy itself, and it's not the software, and it's definitely not your people, then what in the world is it? See, we tend to blame the wrong things, and that's what keeps us spinning our wheels. The real roadblock, it's actually something much simpler, much more fundamental.
And here it is. It all comes down to one thing: ownership clarity. This, right here, is the single biggest predictor of whether a project will succeed or fail. It's not about complicated charts or adding more management layers. It's just a simple, shared understanding across the entire team of who is accountable for what. When every single piece of the puzzle has a clear owner, things just naturally start to move.
Okay, so let's break down how this actually works in practice. And I want to be super clear. This is not about adding more red tape or bureaucracy. It's about using a really simple, lightweight tool to bring clarity to make everyone's job easier, not harder.
And here's the tool. It's just a simple 4-part grid. So for any given task, you assign just one lead. That's the single person who is accountable for the outcome. They're the driver. Then you have your support team. These are the folks who are actively doing the work, the doers. Next is review. These are your experts, the people who provide input or a necessary sign-off. And finally, you've got the inform group. They're the audience. They just need to be kept in the loop. That's it. Super simple, super clear. No confusing jargon.
Okay, let's put this into action with a real-world example we've all lived through, implementing a new EHR module. So take develop training plan. The IT project manager, they're the lead. The buck stops with them. The nursing educator is in the support column, doing the work. And the clinical leads, they're there to review. See how that works? It just instantly gets rid of all that confusion about who owns what for every single task.
So, clarifying roles is a huge first step, but how do you keep that momentum going week after week without drowning everyone in more meetings? Well, that brings us to the second piece of the puzzle, the 10-minute weekly rhythm.
I mean, just think for a second about all the time we waste. Those long, rambling status meetings that go nowhere, those endless email chains where nothing gets decided. This new way replaces all of that with a super focused 10-minute weekly check-in. This is not another problem-solving meeting. It's a quick pulse check designed to surface risks early and just keep things moving.
And this quick meeting is all driven by just 4 powerful questions. That's it. 1, what's been completed? Let's celebrate the wins. 2, what's next? What's our focus? 3, what are the issues or blockers? This is crucial. Where are we stuck? And 4, what decisions are needed and who needs to make them? This structure just cuts through all the noise and forces the team to focus only on what's absolutely essential to make progress this week.
Okay, so you've got clear ownership. You've got your weekly rhythm. So what? What's the actual payoff? Well, this is where it gets really exciting, because these simple changes translate into tangible bottom-line results that really matter to your organization, to your patients, and to your staff.
And we're not talking theory here. This is real. One team that put this framework into place saw a 15% reduction in patient wait times. I mean, just think about the ripple effect of that. Better patient satisfaction, improved throughput, less stress on your staff. That's a huge, measurable win.
It also just makes everything happen faster. Teams that use this framework consistently chop their project timelines down by a whole quarter. And getting a new service or an efficiency improvement launched 3 months earlier means you start capturing those financial and operational benefits 3 months sooner. That's real money and real impact. Fast.
In the financial return, it can be absolutely massive. Check this out. One hospital, just by using this kind of execution framework to fix their MRI scheduling backlog, generated an extra $2 million in annual revenue. $2 million! They didn't buy a new machine, they didn't hire more staff. They just got the project unstuck.
And that really sums up the transformation, right? As the slide says, you move from being rich in ideas but poor in execution bandwidth to a team that reliably turns vision into value. You stop just talking about great ideas and you start doing them consistently.
So I want to leave you with one final thought, one question. As you're thinking about everything on your plate right now, all those important projects, what's the one project, just one, that you could apply this to and get unstuck starting this week?